Today, something to smile about comes from Matthew 7:24, and it reads, "Everyone who hears these words of mine and does them will be like a wise man who builds his house on the rock." Now that's something to smile about. Hi everybody, welcome to the RDH Encore channel. If you're new here, my name is Nikisha and I'm a registered dental hygienist. I know it's been a little while since I posted, but I've been having some medical issues, but I'm getting better by the grace of God. So today we're going to discuss how to decrease the amount of stain that you get on your teeth. With summer right around the corner, I have many people coming in wanting to know how they can brighten their teeth or whiten their teeth. So of course the best way to do this is to avoid the amount of stain that you get on your teeth rather than whitening your teeth. There's nothing wrong with whitening, but in order to whiten your enamel, it of course removes a minimal layer of enamel in order to brighten or whiten the teeth. So of course the best and healthiest way is to avoid the stain in the first place so that your teeth don't have dark stains on them and also that they don't appear a darker shade. So without further ado, let's get right on into it. So 7 ways to decrease teeth staining. Tip number 1 is going to be the most obvious, is to decrease the amount of beverages and foods that contain stain. So this would be foods and beverages like coffee, tea, red wine, berries, and curries. Many of these foods are like heavily pigmented with color, and so that color, once consuming those foods or drinks, they stay on your teeth. So tip number 2 is to drink through a straw. So if you're going to consume those beverages that we talked about in tip number 1, it would be a good idea to use a straw. This way you're sipping everything from the cup to your mouth, straight down your throat, versus it coming in contact with your teeth, or at least having limited contact with your teeth. This is a way to decrease the amount of stain and the pigmentation that gets on your teeth. So that's another good tip. So tip number 3 is to brush and floss regularly. So we all know, if you've seen any of my videos or even just know the recommended amount of time, it's important to make sure that you're brushing twice a day for 2 minutes every time you brush and flossing once a day. Well, if you consume a lot of these stain causing beverages and foods, it's important to make sure that you're doing it a little bit more often. So after consuming a cup of coffee, it would be important to make sure that you are brushing your teeth and flossing your teeth, because that stain from the coffee can get on your teeth and it can also get in between your teeth. So that's why it's important to remove it by brushing and flossing after. If you're not able to do that, at least rinse your mouth out with water. So the main reasoning for this is that clean teeth are slick and they do not attract stain. In contrast, if your teeth contain plaque or tartar, they are more likely to attract more and more stain. So do yourself a favor, make sure that you're brushing and flossing after you consume any of these. So tip number 4 is to use a toothpaste with a stain remover. So 2 examples of these types of toothpastes would be Colgate Enamel Health, which is one of my favorites. It includes a surface stain remover. Also Arm & Hammer toothpaste. It includes baking soda. The great thing about Colgate Enamel Health, of course this isn't a sponsored video or anything like that, but it's just one of my favorites. The great thing about it is that it has a surface stain remover in it, and also it also includes potassium nitrate, so it helps to desensitize your teeth, and of course it has fluoride in it, and it continues to restore the enamel that is lost by removing the stain. But like any other toothpaste, I wouldn't recommend using this habitually. So if you're brushing twice a day, I think it would be okay to use one of these toothpastes. But if you notice that you have any type of sensitivity associated with it, then I would, maybe switch to another type of toothpaste. So tip number 5 is to not use any type of toothpastes or rinses that contain stannous fluoride unless you have gum disease. So habitually using toothpastes like Crest Gum Detoxify, or the new Colgate Total one. I think it's called Colgate Total SF toothpaste, and it contains that stannous fluoride. Parodontax toothpaste or Gingamed mouth rinse. So using any of these products, they contain stannous fluoride. Stannous fluoride does great for your gums, but a downside to it is that it stains. So for people who don't need help with their gums, constantly putting that agent into your mouth will cause stain that isn't necessary. So if you don't need these types of toothpastes or mouth rinses, then try to stay away from them, and that will help to decrease stain. So tip number 6 is to quit smoking. So of course, I'm sure if you've been to any dental visits, or if you've been to see your doctor, or just even watch television these days, it's important to make sure that you stop smoking for your health, of course. or not just smoking, just using any tobacco products such as dipping or using anything like that. A lot of those contain agents that cause staining on your teeth, so it's very important for the purpose of your health, and then also for the purpose of, you know, decreasing stain. It's important to stop smoking or using any tobacco containing products. So tip number 7, which is my last tip, is to limit the use of chlorhexidine mouth rinse for 2 weeks only. So just like stannous fluoride, chlorhexidine is an amazing agent, and it helps your gums. It's actually an antimicrobial mouth rinse, and so it helps to continue to kill off the amount of bacteria in your mouth and in your gums and all that kind of thing, and promote healing to your gums. But a downside to that is also that it stains. So whenever you're prescribed or given chlorhexidine at a dental visit, it's important to make sure that you're only using it for 2 weeks at a time, unless otherwise directed. But keep in mind, if you're using it longer than about 2 weeks, it's going to stain your teeth. Another thing that's important while using chlorhexidine mouth rinse is to make sure that you're brushing as well as you can. Also making sure that you are flossing, because keeping, like I talked about before, keeping those surfaces nice and smooth, it's going to decrease the amount of stain that it attracts. So I hope this video was helpful for you today, and I hope that you will come back and join me for another video. So please leave me a comment to let me know if you know of any other tips that can be used to decrease the amount of stain on your teeth, and also with any questions that you may have concerning this matter. And also, if you will, please like this video, and if you haven't already subscribed and become a member of the RDH Encore family, please subscribe. So until next time, everyone, take care, and remember to let your smile shine. Bye.